As the coronavirus spreads around the globe, there are steps you can take to protect yourself and your family. Here's what you need to know to make good decisions to plan, prepare, and even prevent the spread of the disease. 1. This virus is contagious, but so far it's not as deadly as other outbreaks. Compared to prior outbreaks of novel viruses, this coronavirus appears less deadly than other human coronaviruses that have spread in recent years. For instance, the death rate was about 34% for MERS and about 10% for SARS. The flu causes more than 12,000 deaths a year in the US. An annual vaccine is the most effective way to prevent flu, but there are other strategies to prevent it. So far, there's no vaccine against the new coronavirus, but some of the same strategies to prevent flu can also protect against coronavirus. 2. To fend off coronavirus, follow flu prevention tips. The top tip: wash your hands. Viruses can spread from person to person via respiratory droplets. When an infected person coughs or sneezes, close contacts can be infected. In addition, the virus can end up on doorknobs, elevator buttons, and other surfaces. If you touch those surfaces and then touch your eyes, nose, or mouth, you can become infected. Wash your hands often with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. 3. Don't panic, start to prepare. Think about the threat of a possible outbreak in your community the way you'd think about a big snowstorm or a hurricane. If it never hits, great. But if it does, you'll be glad you prepared. Don't hoard, but do stock your cupboards with some extra food and cleaning supplies. Each time you grocery shop, buy a few extra items. Shelf-stable foods such as beans and rice are good options. Also, utilize your freezer to preserve foods, everything from meats and vegetables to cooked grains and bread. Think about having enough on hand to last a few weeks. 4. The uncertainty of masks to prevent illness. Overall, there's not conclusive evidence that wearing a face mask can help prevent being infected by the virus. And public health officials give mixed messages about usefulness for the general public. As we've reported, masks may not fit the face tightly, so you're still able to breathe in infected droplets. And experts worry that masks can give a false sense of security. 5. Be smart about travel. Travelers should avoid contact with sick people and clean their hands often by washing with soap and water for at least 20 seconds or using an alcohol-based hand sanitizer with 60% to 95% alcohol. If you've planned a cruise or overseas travel, consider the possibility of travel disruptions in the event of an outbreak. Think about the consequences of being caught on ship or over a border when decisions are being made that could limit or disrupt your travel without much warning, says Christopher Moraes of the George Washington University. If you were quarantined, what would your backup plan be for your work and family responsibilities back home? This is something to consider. I hope this helped. Thank you for watching. Please don't forget to subscribe for more updates.